You know how runners are. They're like, I have a marathon in 3 weeks. And I'm like, okay, what do I do?
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, so our next guest is a little bit more well-known in the running world, and I'm about to reveal to her where she exists in the mom underwebs, if that's a thing. She goes by Dr. Lisa on Instagram. She's a physical therapist based out of Richmond, Virginia. Yay, we've got some Virginians in the house today. So Lisa MITRO, thank you for joining me on the podcast.
Yeah, thank you so much for having me. I would love to know where my name pops up because I've been told like don't Google it your name with like Reddit, and I'm just like sometimes I do it. I'm like this is
No, don't. No. Yeah. Yeah, so it's funny. I feel like there's different parts of running world, and obviously I'm kind of more in the pregnancy, postpartum, menopause side of things. And so I'm always curious what in these Facebook groups, and this one is actually on another podcast Facebook group. So this is on the Ellie on the Run podcast Facebook group, which is dominated by women, and there's a lot of us moms that are in there. And it's amazing how many like injury questions pop up in there and how many pregnancy postpartum questions pop up in there because people just feel very safe there. And that's kind of where I'm sure I've heard of you before, but that's where it kept popping up and people were asking like, oh, I got this foot problem, I got this ankle problem. I was like, Dr. Lisa's program, go. And I'm like, who is this? And then we just realized a few minutes ago that you were here locally and worked for some friends of mine when you were first out of PT school. So we have, but yes, once you get to the underwebs of like mom, like we have this like dark web thing where it's like, if a mom knows you, everyone will know you.
Okay, that's incredible. I need to be in this Facebook group just because I love like, you always want to know what people are saying about you. And like I always take it as constructive criticism. I had learned that the hard way just being online, but it's always interesting to hear what people say. And hopefully it's mostly good, but
it's all good. It's all good. So let's back up a hot second. And you're obviously a runner and you've been a PT. Were you that girl that like, I'm going to PT school because I want to help people? Or were you like, I want to go and work with runners because this is just who I am?
I don't even know if I was either. I mean, I guess I was the first one because I got into like the PT side when I was in high school, actually. So I had the opportunity to do like a sports medicine. It was at like the tech center with like the car kids and the hair people, like those type of tech centers. And then they just threw in sports medicine. And I was like, oh, this sounds really cool. And like, I wouldn't have to take physics in high school. Like, that sounds incredible. I know.
It does sound incredible as somebody who had to take physics in high school. Yes.
Yeah. And as an athlete, because I was playing softball in high school and I played it in college, I was like, wow, this just sounds like really interesting. So in that tech center, it was really more athletic training based, but you just learned like more about the body. And it was just like very eye opening. And I thought I wanted to go the AT route, but being a D3 college softball player and trying to get my AT hours was just like, it wasn't happening. Like I was like, I literally feel like I don't have a life. I can't even like study. Like it was just like not for me. And I also didn't love like on the AT side, like, you're just waiting for someone to get injured, which I guess you're doing as a PT, but you need a better attention span than I have, to be honest, because you just have to watch every detail of the game. Yeah. And I did not have that at all. I was more like, I'm more interested in like the clinical side. Like, when are we going back to the clinic? So I was like, okay, I should probably do another route. So I switched to the PT side. I just find everything in sports medicine is like fascinating and like just the way that the body worked. And like, I obviously have a love for helping people. So I think it was kind of like a mix of a couple things. And then at the time I decided to go the PT route, my brother had just gotten into PT school because he was like the injured baseball player all the
Oh,
time. So he went that route. So we had like two different routes, but so I was like, oh, that's so he was telling me more about like obviously like PT. So that was really helpful.
I have never met a brother sister PT group. Like,
Well, it gets interesting because he married a PT and then my husband is not a PT, but his mom was PT.
oh, there's a lot in there. That to me, I no offense, that sounds like third circle of hell to me.
I know.
That's too much PT.
I know. So I feel like it's just like a lot of like conversations in the family are just
Oh
like,
yeah.
what do you think about this?
Oh God, no, I yeah, no, no, my husband's in IT, and so I feel like we're complementary in that respect where like he knows enough to like ice or heat first,
Mhm.
do some NSAIDs or something and then ask me, whereas I know to like unplug and then turn it back
Mhm.
on before I ask for help. We do
Yeah,
the basic things.
exactly. I mean, I definitely like that my husband's not a PT because I feel
Yeah.
like after work I'm just like
Mhm.
he'll ask me basic questions, but I'm
Yeah.
like, thank you for not asking me like and knowing the detail. Like I don't want to talk about
Yeah, exactly.
that.
So when did you make the leap, from and I always find this fascinating because there's those of us that we've run like our entire lives, and then there's others like yourself where you did like soccer or softball, and I mean, you even did it in college. What made you decide to make the leap to running?
So I started running in grad school because it was like post college softball. I was like, I have to do something. And then when I worked at Annie and Christina's clinic, which was my first job outside of PT school, um, you kind of realize after PT school, you're like, I have a life now. Like, I don't know what to do with my free time. And if you know where their clinic is, it's very close to the water. And that's where I lived.
Mm.
And I was like, treating all these runners there because it was a sports medicine
Yep.
clinic. And I was like, okay, let me actually like get outside and like
Yeah.
move my body and like start. I would run like a little bit more than I did in grad school. It was nothing crazy, but it was consistent because I had like an actual schedule with free time. So that's when I started treating more runners and then started getting more into running was really during my first job outside of grad school. And then I just learned so much about running when I was there. Like I'm so thankful for that job. Even though it was short lived, like I'm very thankful for it because I was just thrown runners at me. And I had that
Yep.
student mindset where I was like, I know nothing. Like, who cares that I'm a new grad? Like, and have my PT license, I really was like, I need to absorb everything
Yeah.
and not be afraid to ask questions. I had a great mentor. I was working with a lot of PTs who had run multiple marathons. So, like, I was really thrown in it in the best way possible.
Yeah, you kinda can't I feel like if you I mean, because their clinic solutions, is in Alexandria, and we're right here in Arlington. I don't think you can live in Northern Virginia without either working with runners, knowing runners, like, the trail system's fantastic, like, our
Mhm.
weather isn't that awful, so even when there's ice, it's gone in, like, a day or 2, like, it's a great running city, we have some great races here. Um, what did you learn? You share a little bit about your story, kinda how you came to work more with runners, on your website, but tell us a little bit about what you learned when you started to run more.
Well, I was very like, okay, if I'm going to treat this, because you know how runners are, they're like, I have a marathon in 3 weeks. And I'm like, okay, what do I do? Don't freak out. What do I do? So their philosophy, like in the clinic, was very like, find one thing you can do to decrease their pain during that, during their PT session. So I feel like I just one, I learned to look at the whole picture, but I learned that from Shenandoah. I was able to apply it in PT solutions and then, or solutions PT. I always forget. But
Yeah, Andy and Christina's place, that's what I call it.
so I learned to treat the whole body. Like, who cares if they just have knee pain? I have to look at the foot and ankle. I have to look at the hip, the low back, their running gait. Like, I can't just be like, oh, just do this, just do this one
Right.
exercise and you'll get better. So I really learned to treat the whole body. I also learned to definitely work more on like the stability side with non-traditional PT exercises. So I was seeing like, I was not seeing the clamshells, the bridges, the side steps, the
I
monster walks.
hate
Like
clown shows. I do.
Same. And they're always done wrong. So it's like, just, there's other things that you can do. So
Yeah.
those were the exercises I learned in PT school in like the TheraX class. But then
Yeah.
when I got there, I was like, whoa, wait, these are so different in the best way.
Yeah. No, I see that a lot. And I'll pull you over to the dark side and for a second here into pelvic floor land is, and you might have even seen this. The school that you went to, Shenandoah, one of the higher faculty, as we were talking about earlier, is very into pelvic health. Karen Abraham, a dear friend of mine. We get a lot of these new grads that come out into pelvic health, and a lot of them are, jumping out and working with runners now. And you bring up a really good point. You're like, hey, I learned basic stuff, but then I went here where they actually work with runners and we do a whole bunch of different stuff. And I think that happens a lot with these newer providers is they try and make it work with the baseline stuff. And I'm like, no, 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 you really need to understand runners and run specific exercises and that whole other ortho sport side of things, that if you don't get that, like you're kind of missing the boat here. So for
Definitely.
you, how did that evolve from like, hey, I'm learning this more run specific to, now people are like quoting you in Facebook groups and being like, her foot program got me through whatever. Like, walk me through that kind of metamorphosis. How you're like, okay, this is what I need to do, and this is how people need to access information.
Yeah. So I think when I was working like as a new grad, it wasn't in my head yet that they were running specific exercises.
Yeah.
That's what I labeled them, but it was more like functional exercises that are based off the goal of the patient. So if you're a runner, you want to get back to running, they need to be running specific exercises. If you're a lacrosse player, they need to be lacrosse specific
Yeah.
exercises, like you have to, and what that really means is you have to break down their goal. So knowing what a runner does, it's a lot of single leg movements, unilateral movements, stability, single leg stability. So it's like, okay, I need to break down where this runner's like movement patterns a little bit faulty or where they're a little bit more weaker, and then kind of like break it down, strengthen it, and then build it up. So I think that was one thing that I really appreciated was like learning the movement patterns of an injured runner and then being able to compare them, down the road when they're not injured, they're not having pain. And like, what do those different movement patterns look like? And is this why they're having pain? Because
Yeah.
it's one thing to just be like, oh, you have weak glutes. And it's like, okay, great. Like at this
So
point,
over the glutes.
every runner has weak
I
glutes.
know.
But
Like, do you even know where the glutes work in the gait cycle? Come on here, people.
I know. And it's like, okay, well, is that actually like contributing to this faulty movement pattern
Yep.
and the pain? So I think like breaking down the movement, like if a single leg heel raise is painful, okay, let's break it down even more. And like, what is going wrong here to make it,
Mhm.
or that could make it painful? So I think I learned that really well. And then I mean, the online space just kind of like, I don't even know. I'm like, I don't even know what year I started it. I guess it was 2021, early
Yeah.
2021.
Yep.
And I used it as a way to just keep myself accountable with running. It literally did not start as anything crazy. It was just like, I went for a run. It was so cringy. Like, please don't scroll back to my first coach.
No, there's a lot of things that wouldn't fly now from I'm thinking because the anniversary of lockdown was 5 years ago tomorrow. So I'm like, yeah, there's a lot of things that we put up back then that probably wouldn't fly now. Although it was kind of
Yeah.
nice. No, you just throw something up there, see what happens. So
Yeah.
how did you kind of figure out? So you've got a couple things that you put up there. You have like, foot and ankle. I think you've got some hip stuff. Like, how did you figure out like, hey, this is kind of, because I feel like that's one of the hardest things when you've practiced as a PT and putting out general education or products or things like that is there's so much nuance to the person that we have in front of us and the ability to go back and forth and ask questions and really kind of narrow it down. And putting out a general product, you're saying, okay, in general, this is what I would do, understanding that not everybody I kind of have this rule of thirds. It's like a third of people, no matter what you give them, they're going to be fine. A third of people, you give them one particular cue, will be fine. And a third of people, they really need that kind of like nuanced individual approach. Like, how did you reconcile? Because that's one of the hardest things when I put stuff out is like, how do you reconcile this nuanced kind of experience that you've had and then turn it into something very, very general?
Yeah. So I think the main things that I looked at was like I was treating a lot of one-on-one runners at first. Like I was not doing this like as a new grad, that is for sure.
Yeah.
Like I felt like I had a good amount of experience. I really understand running. I took my running form courses. But I think one thing that helped me was like when I was treating even like my one-on-one runners virtually, I'd be like, okay, they have the same movement pattern as this person
Yeah.
does. Like it
Yep.
was really about the movement patterns more
Yep.
than like let me throw out every single exercise you could
Right.
possibly do to strengthen your foot and ankle. So realizing like, oh, you don't use your big toe. Like, hey, your calcaneus is everting when you're doing a heel raise, like stuff like that, or like your midfoot's tight, or whatever it was. Like I was just able. It was like basically make a list. I mean, I didn't. I did this like more in my head, but it
Yeah.
was like make a list of all the movement patterns that a runner could
Hmm.
have with shin splints, like the overuse injuries.
Right.
Not anything crazy, not the torn ligaments, nothing like that.
Right.
Like more so like the overuse injuries where it's like, hey, I have some shin pain. That's 5 out of 10 when I run. And then when I stop, it goes away. Like it was very like, what are the movement patterns that this person could possibly have? And then what are the exercises that could help them with this movement pattern? And then how can I make it running specific and then progress them each week into um more like progressive exercises because the big thing so like after I worked at Annie and Christina's clinic I worked in a traditional outpatient clinic so I was working with a lot of PTs but on one side it was like I was working with a running specific PT and I mean she just gave out the most general exercises I've ever seen in my
That
life
was
and I
an
was like
eye roll if you're listening and not watching on YouTube.
I was and I was like just getting into more running like I was like oh like how is that like first of all like okay, let me just say, like when she would have people squat, she wouldn't let their knees go over their toes. So it's just like,
Oh
what
God.
are we like? There's just certain things where I was
That's
like,
okay in case you're listening. Knees over the toes. Okay.
yeah, and I know, and it was just like, I don't think I'm going to like use you as a mentor in the back of my head. But then I had other PTs that were like super super helpful. So, um, yeah, I think it was just a lot of like me I'm a very observant person like
Mhm.
I will like if I have windows on each side here and I'm like if someone's running out the window I'll just stare at them and like watch their form like I mean that's what PTs are so it's
Yeah.
like I don't know it's just able to basically like piece apart the movement pattern and
Yeah.
then really test it too. Like I was not like this is a perfect product at all. It was like, hey, if you don't want to go see have the chance of seeing a traditional PT
Yeah.
that doesn't necessarily know much about runners, then this could be a
Right.
good option.
Yeah. Have you just out of curiosity because our profession sometimes we eat our young, as I'm sure you're aware. Um, did you had this was, 2021 you're putting this stuff out and I think more and more obviously more people have put stuff out. Did you get any pushback at all from other PTs that you knew about, "Hey, why are you putting this out?" Or are they like, "Wow, I should have thought of that. I'm an idiot."
If I did, I am not aware of it.
Oh, that's nice. People just talked in secret.
Yeah, probably. And I'm fine with that. I mean, whatever. But I didn't I okay, so when I started creating content, it was like January 2021. It was super cringy and it was just like I don't even know what I was doing. Um, but that was not like the rehab programs were not the first program I came out with. So I was
Mhm.
treating like one-on-one clients, getting more exposure to runners for probably like a year and a half or something,
Mhm.
like more than a year before I put out my rehab program. So I mean, they could have been talking behind my back, but no one ever messaged me and was like, "Hey, what are you doing?" Because I think I made it very clear, like, "Hey, this is not for like if you feel like you have a stress fracture, night pain, like
Right.
this is for the overuse injury. Like, do
Yeah.
not get that twisted." And it's also for the person who isn't in severe pain, like isn't the person who also is, feels like they need manual
Yep.
therapy. Like so a lot of my programs that I sell, I actually talk one-on-one with them before in my messages or emails. Like I get
Yep.
emails all the time. So I try to screen that and then just make sure like they're a good fit too.
Yeah. I think that's something that, it's been a lovely evolution in our field, has been not having to kinda exist in that brick and mortar format. I don't know if you ever had to, so in PT school, and I won't say when that was, we had we had to, like, make your own clinic, and of course, everybody's clinic looked the same, and it was like the basically like the old Health South or NovaCare or things like that, and you're spending, your budget's on, TheraBand and, stupid, new step machines and dumb things like that. And I don't think we, and at that time, even private practices were not owned by women. Um, it was some dude, and all of us were in our polo shirts and our khakis,
Yep.
right? With a logo.
Yep. I remember
Um,
that all too well.
oh, sad. R.I.P. Anyway, no, but I think, understanding that not everybody can get to a brick and mortar clinic, or and I mean that was kind of the circumstances at the time in the 2020s and 2021s, is, the access was tricky um with COVID. And, just us seeing ourselves as educators that can provide basic information. Yes, we're going to caveat it saying we're not your individual therapist, and that kind of stuff. But I feel like it was a huge step forward for our field in general to kind of put our expertise forward and say, hey, we know things, and if you're buying something from whoever online that took a weekend course training and they got hurt and fixed themselves, and you can too, like we put ourselves kind of up a little higher, which I think we should.
Yeah,
Um,
for
but
sure.
it again, like I love it in these Facebook groups when it's people are people don't want to be hurt. They're like, I've got this little niggle, I want to do something. And when the pathway in your head is, oh crap, I'm hurt, then you ignore it for a while. You go through like the stages of death and dying, right? You're just like, nope, that's not really happening, all of that. And then you think of, okay, well, what do I need to do to get help? Oh, I've got to make the doctor's appointment. Okay, that's 3 or 4 weeks right there. And oh, they're going to refer me. And then that's 3 or 4 weeks there. And I got to find a PT, and maybe they're not running specific. Like, I can't blame people for going online and Google searching and being like, who has something that I can literally purchase and have in my phone right now and get this fixed, or at
Mhm.
least try to. I mean, what's your experience? I mean, obviously we've been in the profession a little bit different period of time, but like, was that kind of a big step or a weird thing? You're just like, yeah, this is just what we do.
So that's interesting you say that because I completely forgot that the Facebook groups are the reason that I started posting rehab exercises online. So I
We're bringing
completely
you
forgot
down
that.
your memory road here, like your
Yeah.
memory lane.
So I said that I posted like cringy photos of me like post run, and it really was to keep me accountable. Like because basically like when I lived in Alexandria, I was running, but then I moved back to Richmond. I got a house, got a dog. Like I took a break from running, so I was like, okay, I got to get back into it. Let me like step into the running space. I don't even know what triggered me to do that, to be
Yeah.
honest, but made an account, followed random people. They followed me back. Like it was nothing crazy. And
Yeah.
then I started like following these Facebook groups for running, like runners love running, or I don't know, just like Facebook groups that had huge amounts of people. And I
Yeah.
just remember being like, oh, this is like terrible information.
I know.
Like I was like, you're gonna get hurt if you follow this information. Like it was
Mhm.
like, oh, I think I have an ACL tear. What should I do? And people are like, just keep walking and running. And it's like, no, like we need to, like PTs need to step up because people
Yeah.
who aren't qualified are easily giving out information, like
Mhm.
they have no problem with it. And that's when I remember being like, let me just post like a couple tips about running on Instagram. And people kept asking me questions, and it kind of just
Yep.
escalated into what it is. But it really was like the awful advice that you see online, mostly on Facebook at the time. Like it wasn't really
Yeah.
Instagram, but mostly on Facebook. And I was just like, I feel like I have more knowledge than the next person.
Yeah.
I should use this knowledge or use, what I've learned so far. Because even at that time, I was like 3 years out of PT school. I
Yeah.
still don't even like, I'm 6.5 I don't know, almost 7 years out. So it's like I still don't even feel like I know. Like I'm never gonna feel like I know it all, but I'm at least gonna feel like I know more than the
Yeah,
next person
yeah,
in order to help someone. So I think that that was really what
yeah.
kind of like did it for me was I was getting so mad at these Facebook groups.
You have to, like, what I have noticed is I have to, like, measure out the amount of time and energy I spend in those because you can get really worked up. You're just like, "Oh, I can't believe this person said that, and that's awful advice," and, like, you have to measure it or else it just, like, can be a lot. So
Yep.
give us some examples, like, what's the worst advice that you've seen where you're like, I have to say something. I have to say something."
That's been a lot recently. I'm like, dang, I'm really wasting my energy sometimes. Especially like
It
TikTok. I don't know.
I have to measure going over there. I don't have enough time to crack all those eggs on my
Mhm.
plate, but they're great content.
Yeah, I know. It's just like, yeah, I think I've really realized like I'll never be able to reach every single person. And
Right.
even if I say something, that doesn't even mean they'll listen to me. It doesn't even mean they'll see it. Like there's so
Mhm.
much noise online. So I
Yep.
really was like, okay, Lisa, like let's think about where you're wasting your energy and like because it does matter. It's draining if you're always trying to
Yeah.
like feel like you're defending yourself, but our it's our
Yeah.
degree. Like that's I don't
Yeah.
know.
What are,
Um
like, the 3 things that are coming up most recently where people are just getting it wrong?
um I would say stretching for shin splints. I think that's
Mm.
a big one.
What would you rather people do?
Strengthen. Like I think the big thing about shin splints is like you have tight calves and people are like, "Oh, just stretch it like nightly." And it's like, "No, like let's figure out why it's feeling tight." So that's, another big thing I learned throughout like my PG school and then my mentorship was like fix the source of the pain.
Yeah.
So like don't chase symptoms, figure out why those symptoms are coming on. I'm trying to think. I think the big thing too right now is about bunions. I talk a
Mm.
lot about the big toe on my page, so I feel like I always get big toe questions, but definitely like bunions, like if you can avoid them, even if your grandma has them, like stuff like that, where it's like, yes, you definitely can. Like there's a reason that bone is forming on the inside of your big toe. It doesn't all have to be genetic. I haven't even looked at the research to see if like any of it is genetic, but I know that you can definitely like prevent it from getting worse.
Mhm.
Trying to, obviously, like running is not bad for your knees. I feel like
Right.
I'm gonna,
That's a
oh,
whole
heel
nother.
striking. How could I forget about heel striking and how just terrible it is for you?
It's kinda like all these things I feel like are like red wine. Is like, one year red wine's gonna kill you, the next it's gonna save you, and I was just like,
Yeah,
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 and it so the ones that kind of float over into the dark side in pelvic health land are the ones that, and this sounds so ridiculous to anybody who's an ortho in sports, where you just went through, this major medical thing, and then all of a sudden 6 weeks later, when you've done absolutely nothing and probably didn't do much 9 months before that, "Hey, we're okay, and go start running and see what happens." Of course, you're gonna get shin splints, and, oh, by the
mhm,
way, your foot changed sides, your center of mass and your center of gravity is completely different. Your brain thinks you're one place that your body is not, like, yeah, never
mhm,
mind those things, but yes, you're gonna get shin splints. And
yeah,
that's the one thing that, like, I can't tell you how many people, like, they can't even get to the pelvic floor part because the first thing that takes them down is shin splints. I'm like,
yeah,
"But when all of this has just occurred and you haven't done anything." But
yep,
they, like, flash back to, like, the last time they had shin splints, which was, like, high school track or something like that, and, their coach, who was probably the football coach, was like, "Yeah,
mhm.
go ahead and stretch it," and then that's what gets stuck in
I
people's
say,
heads, like, what they learned in high school track from some really kind dad that volunteered his time to make some extra money.
literally. And that's exactly what it is like they're volunteers basically
Mhm.
telling you what they knew in
Right.
like the 50s. And it's like, hey, there's like a lot of new research out. Like we don't have to go down that rabbit hole of like rest, ice, compression, elevation.
Yeah.
But yeah, I know I took a pregnancy and postpartum course. And I was like, wow, this
Oh, who did you
is
take it from?
Oh
Oh, I put you on
gosh.
the spot now.
Sarah Duval. Does that
Okay.
sound right?
Yep.
It was just so eye-opening. Like I did not expect, like I was taking it because honestly I had like a ton of pregnant friends and I was like,
Yeah.
this would be great for continuing ed and like I should obviously know this if I'm treating runners. Um, but it was very, very eye-opening. And it's like I mean, it was just, yeah, I really enjoyed it. But it's always crazy to learn like of all the changes that happen
Hmm.
postpartum. And then it's like anytime someone says postpartum with like any sort of injury, I just say like, hey, you should probably see like a pelvic
Yeah.
PT or like a women's health PT because like, yeah, you might have shin splints, but you might have also just like gone for like a 5 mile run as your first run back.
Yeah. Well, that's why I feel like we really have to walk the line. And I've always encouraged people, I'm like, hey, if you're pelvic health PT and you're not running informed, partner up with somebody who is, and then you have a great mashup. Like you don't have to learn all the things because it's a lot. It is
Yeah.
a lot to understand and keep up with both. Um, and to expect to do both really well, you have to have been at it, I think, for a long time too. Like back in the day,
Yeah.
like we did them very, very separately and we didn't acknowledge that they, needed to be a mashup. But like you don't necessarily have to have to, it's really hard to find one person that does all of that. But
Hmm.
if you have just enough where like for you now, you know enough to be like, hey, there's something going on here. And down in Richmond, I think, oh gosh, is Trish
There's a,
Tavares down there? I think she is.
what is her Instagram handle?
Burpees and
Yeah.
burpees and burp
Yes.
cloths. Yes.
Yes.
Yeah, she's down
Yes.
there too. And she's doing ultrasound. Yeah, I mean, you guys
Mhm.
obviously, should connect if you haven't already. Um, but yeah, I mean, it's just so much growth in, what we learn in research and that sort of thing. So for you, just,
Mhm.
in the time that you've been working with runners, what are the two or three biggest changes in how you've kind of approached runners because of shifts in research? What do you think those might be?
Definitely like the acute soft injury protocol. I think that's really big right now. So like, hey, rest is not like the best thing for you.
Yeah.
I think that's really important because most running injuries are from overuse and
Yep.
it's not, it's obviously good if your gut is saying, hey, I might have a stress fracture, you have signs and symptoms of stress fracture, sure. But a lot of the time, like I think it's really cool that runners can rehab and run at the same time.
Yep.
I mean, they still might, there's still doctors out there that are like, hey, you should take 2 weeks off from running and take this
And then just
anti-inflammatory.
and then start up again and see what happens. Yeah, no, that
Yeah.
I think that's a really, I mean, that's along the same lines of, hey, don't do anything for your pregnancy and 6 weeks of postpartum and then go for a run and see what happens. Like it's gonna suck. Like it's gonna
Yeah.
suck. Yeah.
Exactly. So
What else?
I think that's cool. Let's see. I think, well, just in general, like my treatment for plantar fasciitis has changed a ton. And I treat, a ton of runners with PF. So,
Hmm.
like not necessarily when I was at Andy and Christina's clinic, but I
Hmm.
was in like the outpatient traditional Ortho Virginia clinic.
Yeah.
Um, I just remember like I hated when someone with PF would come in because I'm like, I don't know how to fix you. Like I was like, get the insoles, roll the arch with a frozen water bottle every day for 5 minutes and stretch your foot like this. Like I was like, and get new shoes and good luck. And I was like, and come back in a
Yeah.
couple weeks because that's what I learned. Like
Oh, I think
again,
I
I
threw
don't,
some iontophoresis on it back in the day.
yeah, literally yeah, ultrasound that. And yeah, I was like, I was not confident at all in
Yeah.
treating it. Um, so I think there's just been like a big shift in what I've learned about PF and like how to treat PF. And I think that's really exciting because I've had PF, I've had plantar fasciitis and it was like
Yeah.
the worst. So I
So
think,
for people that
yeah.
aren't well versed in the PF words, plantar fasciitis, will make it super dumbed down, is like you have pain on the bottom of your foot. And so for you, like what if I came to you and I'm like, all right, what are the first three things I should be doing? From what you said earlier, it's not grab the frozen water bottle and do all those things. What are the first couple things that I should be doing if I have pain in the bottom of my foot?
So I think one of the big shifts was just learning about the big toe and how important the big toe is. So working on big toe stability and big toe mobility. So stretching out the big toe versus and that you can feel a stretch, of course, in your plantar fascia when you do that, but just being able to like strengthen the big toe and strengthen the muscles under the plantar fascia, that's
Right.
like game changing for
Yeah.
it's like a game changer. So it's like instead of me digging my thumb into your plantar fascia that feels
Oh,
tight, which I mean, I'm not gonna like, I'm not mad at myself back then because I didn't know any better. Like I really
we
didn't.
didn't either. It wasn't
Yeah.
just you. And I think that's the important thing too, is like when we did something earlier in our career, it's because, yeah, maybe some people didn't know better, but like we didn't have data. We didn't understand things the way that we do now. So,
Yeah. Yeah. So it's, I mean, that's amazing because then it's not like you're putting a band aid on the
yeah.
pain and you actually are able to address the source of the pain. So I think being able to do that and then like strengthen the calf, work on gait, even and like center of mass in your foot and like where you're holding, your balance and stuff like that can play a really big role too. So it's always like a couple different things. I like to say, like, it's never like with an overuse injury, it's not like, oh, like you just have to do this one thing. Like it's pretty rare if it's one single
Yep.
muscle involved or like
Yep.
you only have to do this, like
Yep.
I'm sure you see that all the time, but it's like that's the part where it's really hard to break through on social media and like get my point across because I
Yep.
have 10 seconds to convince you that you need to do all these things and also who
Yeah.
wants to do all those things.
Well, I think I've had a lot of conversations lately. Mostly it's with friends that consume social media and don't create content for educational purposes. And it's marketing versus like marketing principles versus medical educating principles. And so marketing principles say, I've got to get your information in what is it, however many seconds, like none.
Mhm.
And then us as educators, we obviously want to elaborate a little bit more, and PTs, we can be a little chatty. So, I mean, how have you found that balance? Because I feel I'm the same as you. I mean, and Zuckerberg be damned about, okay, we're doing 7 seconds now. We're doing 3 minutes. Like, I don't even know. But like, how have you kind of found that balance between you're trying to get somebody's attention in the void, but you also don't want to compromise on making sure that the information that you put out isn't, overly sensational, but it's got some meat to it.
Yeah, that's a good question. So like when I was in PT school, I remember I had a clinic rotation and I had somebody in the clinic rotation from another school and like the way that they would talk to patients, I was just like, wow, you sound like you know your stuff, but like the patient's not comprehending anything you're saying. And like
Yeah.
I remember my clinical instructor was like, the patient doesn't care how much you know, they care that you can help them.
Yep.
And you really have to like talk to them like fifth grade level.
Hmm.
And it's like, around fifth grade level because you just want to make sure that they can understand like, hey, this is about what's happening and like, you know, using examples and stuff like that. And like, I think just having that mindset really early on,
Yeah.
like no one wants to hear that their gastrocnemius and their soleus and the nerve root is this and like the muscle attachments here. Like they're just like, so can you help me or not? So really dumbing it. I hate to say dumbing it down, but like from what
Simplifying
we
it.
learned in PT
Yeah.
school to like
Yeah.
being able to translate it is so important. I
Yeah.
mean, that's important if you're not online too. But like um, so yeah, I've had to learn how to like, you said PTs are chatty, like so I had to learn how to like really simplify
Hmm.
my content and like simplify this paragraph into like two sentences, like because people don't want to read as much as I like to
I
post.
know. I
But
know.
I think that's really important. And it does take like a lot of trial and error. Like it's taken
Hmm.
me like a lot of learning about like people's patterns and stuff like that. Like, hey, is this huge now I'm blanking on what it's called caption even worth it? Or are people just reading like the first sentence?
Yeah.
Like I think it's and then, too, like being able to just talk to the one person that has plantar fasciitis, or the one
Mhm.
person that I'm gearing that reel or that post towards, I think
Yeah.
is really important, because then it's like you really just have to ask yourself, like, what do they need to hear? Like, if
Yeah.
I was sitting face to face with them in a PT clinic, what do they need to hear if they have shin
Right.
splints, you know?
Yeah.
So
No,
I think that's helped a lot.
and again, like none of this stuff, we didn't learn about this in PT school. I mean, I was joking to a patient the other day. I'm like, I had no idea that my career would involve video production. Like,
I
really,
know,
like, I
right?
don't know, like, yeah, or that you have to write, or that you have to communicate, or, and I do, I feel like, especially now with all the information that's out there, you're trying to navigate the noise, but then also the misinformation, and be like, how do I put myself, like, no one cares the letters after your name anymore. No one's going to look
Not at
into
all.
your CV. Like, no one really cares. They're going to look at you and be like, do I trust you? Do I trust what she's saying? Can I relate to you? Are you funny?
Hmm.
Do I want to hang out with
Literally.
you? That's literally it. Like, if you want to hang out with me, you're going to listen to me. If you don't
Hmm.
want to hang out with me, you're not going to listen to me. And I'm like, which is really hard when you went to school for a really long time to, like, put doctor in front of your name.
Yep. You have to like remove the like the like it's almost like remove what the professionalism. Like, remember in
Yeah.
PT school, like
Yep.
they'd be like, should PTs wear a white coat or not? And it's like, oh, that is like so far out the window right now, because it's just a complete, like, I'm sure you remember this.
It's
It's just so different.
it's so, and I was in one of the last classes that we there was a period of time that you could come straight out of high school and do MPT and then be done. And then, of course, after I finished, then they're like, "Oh, well, we're going to make you do this doctorate thing," which I went and got finished. But, like, again, it's like what you said, like that. Every once in a while, these stupid conversations come up, like, "Should we be called doctor?" I'm like, "No one gives a shit." Like, I'm
No,
sorry,
they
no
don't.
one cares.
The
Or I'll
only
get
reason I
friends.
have it is so people know I actually have a
Right.
degree.
Exactly, exactly. Like, like, I've got a license too. No, but and that's the funny thing, that I think the nuances get lost in our profession, but there's, and that's where I think it's been really curious to watch, kind of content creators in, really make our profession relevant, but, like, I hate to say the old guard, but, like, people who aren't content creators really get their panties in a bunch over, well, you can't say this, or you can do, like,
Mhm.
well, if we don't, then who will? And I'd rather it
Exactly.
be from somebody that kind of knows something. So let's look ahead. Crystal ball. Where do you see, um, where do you see yourself in this space? Where do you see how we provide education and therapy to runners?
Yeah, that's a good question. I think like, so obviously, like before COVID, everyone was going in person to
Yep.
see a PT. And now that COVID happened, it's like, okay, we're getting used to like virtual. Like, we understand virtual. We understand how to use Zoom.
Yep.
Um, but I feel like there's becoming a transition into more cash-based PT.
Oh yeah.
Um, so I don't know. I mean, obviously, I don't know, but I think virtual is going to keep taking off, and there's just going to be more noise. But
Mm-hmm.
there's also going to be more competition with the local cash-based PT,
Mm-hmm.
because insurance doesn't know what they're doing, and I mean, it's just like,
That's a separate podcast.
yeah, it is. So insurance is not going to ever like keep up with us
Yeah.
in terms of like how many visits are, all that.
Yeah.
But I do think that there's going to be more cash based clinics. I think
Mm-hmm.
that people enjoy in person. I mean, you see that all the time now with like fitness. People
Mm-hmm.
want to be in person, whether it's just going to a gym and using an app or doing group fitness. Like, they
Mm-hmm.
prefer that versus being like at home working out most of the time. But
Mm-hmm.
yeah, I think there's going to be way more noise online, which I'm already so sick of some of the noise, but
Yeah.
so really need to pick and choose my battles over the
Yeah.
next 5 years. But yeah, I don't know. I hope that PTs get a bigger voice, because to be
Mhm.
honest, I just don't feel like we're represented very well in person. Like, it's especially like, with insurance and just like
Yeah.
the pay and everything.
Yeah.
Um, so hopefully, like online and on social media, we have a better representation and like people understand our role a little bit more.
Hmm.
But yeah, in terms of runners, I mean, I don't know. I mean, we're always up against, the funny thing is, it's like we're not even up against other PTs. We're up against running influencers that want to be PTs. So I think that's just going to
Yep.
continue. I have no
Yeah.
problem with other PTs in the running space. Like, bring it
Yeah.
on. There's a million plus runners
Yep.
like around the world. I mean, more than a million, obviously, but it's just like there's so many. There's room for everyone. But like, just know that your competition is this influencers. Like, I don't mind running influencers at all. I think they're great, but like, don't cross the line of like, hey,
Yeah.
this is what you should do for shin splints. That
Yep.
bothers me. It just really bothers me.
Yeah. Yeah. No,
So I
I
think
had a
there's some.
coach. I had a coach say that once. Uh, we were at a class in the morning, and this girl came over, and he was giving her advice about her ankle. And I said, "What's wrong?" And she's I always make a joke up front. I'm like, granted, I'm a pelvic floor PT, but I have background in orthopedics. Like, I kind of know what I'm doing. And she's like, "Oh, da da da," and says something about what happened to her ankle. And he's like, "Oh, it doesn't matter." And I was like, "Kind of does." And he's like, "No, it doesn't." And I'm like, "Yeah, it kind of does, because one, you got to pick the right thing to do. Two, you got to make sure there's no red or yellow flags. You don't screw something up here. You just being like, hey, give her a blanket exercise, and you have no sense of what you're talking about when it's an injury. That's over the line, my friend." It's over the line. And I
Yeah.
was like, and he's like, "No, it's not." And I'm like, "Agree to disagree." I'm like, he's also like a 20 something bro. And I was like, dude, I don't have
Yeah.
enough room to crack that egg open on my plate today.
I definitely think, like, did you see the stat last year of like 19% of PTs left the profession?
Hmm.
So
Yeah.
I think that there's going to be
Yeah.
more people trying to get into the online space
Hmm.
because they're burnt out with like, their PT
Yeah.
profession.
Yeah.
So but it's just a matter of like, again, do you trust this person? Do you like
Yeah.
their content? Do they have the receipts showing that they can help you,
Yeah.
or like,
Yeah.
because anyone can say they are a running specific PT, like, oh,
Hmm.
and a lot of people do, and I'm like, I mean, I've
Yeah.
seen your content, like there's no way.
Yeah.
So I think it's just people have to be a lot more cautious, and like
Yeah.
really like word of mouth is going to luckily help some people and then hurt some
Hmm.
people too.
Well, and that's where, again, to go full circle on, the original reason I kind of reached out to you was, um, when I see people tossing names out over and over again, I'm gonna go look. And like you said, like, I need to see receipts. I need to know what your deal is. And, when you have a solid group, and this happens here in our local communities as well, is like, it's and I think that's how things are gonna shift, with so many people, with so much information out, so many clinics. It's like, all right, how do I know really who to go to? And it really is that word of mouth. It's like, I experience this person, I trust this person, they're not full of shit, and it's not, they're just tossing me a hint of truth, and the rest is kind of garbage. Like, this is legit. And I for a lot of different reasons right now, I have a feeling that this is kind of where things are going to be shifting. And it's really hard, because I think for those of us that have been doing it for a while, like you said, the noise is deafening. You just like, am I screaming into a void? Like, no one's listening, and it feels incredibly, and it's a lot of work.
Hmm.
But I think at the end of the day, if we stay true to who we are as professionals and how we signed up to do this in the first place, is to, help people.
Yep. Yep. I know.
And
It's now like, go ahead.
no, and then we gotta stay evidence informed and stay up with the research, which is hard to do. But no, I think if we can do that, and stay true
Mhm.
to who we are, um,
Always. Yeah. I
it
know.
is what it
It's like,
is. But
it's it's like a fancy like balance of like creating catchy content that's honest and not clickbait
right,
and real,
yeah,
and then also like, I don't know, like, being able to educate somebody at
yeah,
the same time. It's like,
yeah,
yeah, it's a
yeah,
wonderful balance that I
yeah.
haven't,
Well, the downfall that you don't have in running land is, here in pelvic health land, we can just don a vagina costume and dance around and get people's attention. I always get pissed when people do that because my friend Sarah Reardon, who goes by the Vagina Whisperer, that was like legitimately her thing. And then
Yeah.
people are like, oh, that's something we do. I'm like, no, it is not something we do. That
No.
is hers. And anybody else is just like, that's
Oh,
not something you will ever see me do.
no, that is hilarious. Oh my gosh, I have not seen that at all, but that's
Oh,
hilarious.
now with the Zuckerberg's listening, so you get on the algorithm now. So, but
I'm
that belongs
sure.
to one person, and that was my friend, and everybody else is just a follower. So,
I mean, that's one way to catch attention though. And then it's like,
yeah, but now
okay,
it's just overused. So.
yeah, yeah, that's like beyond cringy for me.
Yeah, well, anyway. All right. If you guys want to find out more about Dr. Lisa's programs, you can find her over on the gram, dr.lisa.dpt. Thanks so much for chatting with me. I mean, like I said, it's cool when there's stuff that's very accessible to kind of our population that's being put out there. It's good content, very reasonably priced, and it comes from somebody who's like, yeah, you should have some basic information. So
Mhm.
I'm so glad that we got to chat, and so cool that we have so many local connections. And yeah, you're welcome to the dark side anytime.
Well, thank you so much for having me. And if anyone has any questions, you can always message me on Instagram.
Awesome. Thanks so much.
Thank you.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.